Your kidneys work 24/7 to filter toxins, balance fluids, and regulate blood pressure, but certain medications can silently damage them, especially if you have diabetes. From painkillers to antibiotics, everyday drugs can put your kidneys at risk. Learn how to protect yourself, make safer choices, and keep your kidneys healthy for life. Number 1. NSAIDs, the silent kidney killers. Many diabetics rely on painkillers like ibuprofen, naproxen, and diclofenac to manage aches and pains, but these drugs can quietly harm the kidneys over time. Known as NSAIDs, they work by blocking prostaglandins, chemicals that help maintain blood flow to the kidneys. Without enough blood supply, the kidneys struggle to filter waste properly, increasing the risk of long-term damage. Since diabetes already makes kidney complications more likely, frequent NSAID use only adds to the danger. The risks? Acute kidney injury, high blood pressure, and fluid retention, all of which can worsen diabetes-related issues. If you deal with chronic pain, consider safer alternatives like acetaminophen, not exceeding 3,000 milligrams per day, Voltaren gel, or natural options like turmeric, 500 to 1,000 milligrams per day. And here's a crucial warning: never combine NSAIDs with diuretics or ACE inhibitors. This combo can severely damage your kidneys. To stay safe, always check with your doctor before taking painkillers, drink plenty of water, and keep an eye on your kidney function with regular tests. Your kidneys work hard. Help them out. Number 2. Metformin, a diabetes staple that can backfire. Metformin is one of the most commonly prescribed medications for managing type 2 diabetes, but it can pose serious risks when kidney function declines. Your kidneys play a crucial role in clearing metformin from your bloodstream. However, if they aren't working properly, the drug can build up in your system, increasing the risk of a rare but life-threatening condition called lactic acidosis. This occurs when excess lactic acid accumulates in the body, leading to symptoms like muscle pain, extreme fatigue, rapid breathing, nausea, and confusion. If left untreated, lactic acidosis can be fatal. Diabetics with kidney disease should undergo regular kidney function tests to determine whether metformin is still safe for them. If kidney function drops significantly, switching to alternative medications like sitagliptin, DPP for inhibitors, or empagliflozin, SGLT2 inhibitors, may be necessary. These options not only regulate blood sugar, but also help protect kidney function. If you take metformin, stay hydrated, monitor your kidney health closely, and be aware of any warning signs to prevent complications. Number 3. ACE inhibitors, friend or foe. ACE inhibitors like lisinopril, enalapril, and ramipril are commonly prescribed to diabetics to control blood pressure and protect the kidneys. These medications help relax blood vessels, reducing strain on the heart and kidneys. However, if kidney function is already impaired, ACE inhibitors can sometimes do more harm than good. They work by lowering blood pressure, but in some cases, they can reduce kidney filtration too much, leading to a dangerous buildup of waste in the body. This can result in swelling, extreme fatigue, confusion, and even kidney failure in severe cases. Additionally, these medications can cause potassium levels to rise, which may lead to irregular heartbeats or serious heart problems. That's why regular blood tests to monitor creatinine and potassium levels are crucial. If side effects occur, your doctor might recommend switching to losartan or valsartan ARBs, which are slightly gentler on the kidneys. Always talk to your doctor before making medication changes, stay well hydrated, and monitor your kidney health to avoid complications. Number 4. Diuretics, the hidden dehydrators. Diuretics like furosemide, Lasix, and hydrochlorothiazide are commonly prescribed to manage high blood pressure and fluid retention, but they can be a double-edged sword, especially for diabetics. While these medications help your body eliminate excess fluid and salt, they can also cause severe dehydration and disrupt electrolyte balance, increasing the risk of kidney complications. When dehydration reduces blood flow to the kidneys, it can lead to acute kidney injury and even long-term damage. Another concern is potassium imbalance. Traditional diuretics can drain potassium levels, leading to muscle weakness, irregular heartbeats, and dizziness. Meanwhile, potassium-sparing diuretics like spironolactone do the opposite, causing potassium levels to rise dangerously, which can trigger serious heart problems. If you're on diuretics, drink plenty of water, monitor your potassium levels, and avoid mixing them with NSAIDs or ACE inhibitors. Watch for warning signs like extreme thirst, confusion, or muscle weakness, and consult your doctor immediately if they occur. Proper hydration and careful monitoring are key to protecting both your kidneys and overall health. Number 5. Proton pump inhibitors, PPIs, stomach relief at a cost. PPIs like omeprazole, pantoprazole, and esomeprazole are commonly used to treat acid reflux, heartburn, and ulcers. While they offer relief, long-term use may silently increase the risk of chronic kidney disease, CKD. Research suggests that prolonged PPI use can lead to kidney inflammation, interstitial nephritis, which, over time, may cause kidney function to decline without noticeable symptoms. This is especially concerning for diabetics, who may already be at risk for kidney issues. Many people take PPIs daily without realizing the potential dangers. The tricky part? Symptoms of kidney damage often don't appear until it's too late, making regular kidney function tests essential. Additionally, PPIs can lead to magnesium deficiency, which may cause muscle spasms, irregular heartbeats, and chronic fatigue. If you rely on PPIs, consider safer options like H2 blockers, ranitidine or famotidine, or natural remedies such as ginger tea, aloe vera juice, and smaller meal portions. If PPIs are necessary, use the lowest effective dose for the shortest possible time to protect your kidneys. Number 6. Antibiotics, the unseen kidney strain. Many commonly prescribed antibiotics, such as gentamicin, ciprofloxacin, and vancomycin, can be surprisingly harsh on your kidneys, especially if used excessively or without proper monitoring. Since these drugs are processed through the kidneys, overuse can lead to acute kidney injury or even chronic kidney disease, particularly in diabetics who are already at higher risk for kidney complications. Some antibiotics, like sulfa drugs, Bactrim, can cause crystal formation in the kidneys, leading to painful blockages and potential long-term damage. Others, like aminoglycosides, gentamicin, streptomycin, are directly toxic to kidney cells when used for extended periods. If you need antibiotics, always take them exactly as prescribed, drink plenty of water, and never self-medicate. Whenever possible, ask your doctor about kidney-friendly options like doxycycline or azithromycin. If you notice symptoms like reduced urine output, swelling, or lower back pain while on antibiotics, seek medical attention immediately. Your kidneys work hard to keep you healthy. Give them the care they deserve by using antibiotics only when truly necessary and under strict medical supervision. Number 7. Herbal supplements, not always harmless. Many diabetics turn to herbal remedies for blood sugar control, believing that natural means safe. But some herbs can silently damage your kidneys. Aristolochia, found in some weight loss teas, has been linked to severe kidney toxicity. Licorice root can raise blood pressure and lower potassium, straining kidney function. St. John's wort may interact dangerously with medications. The real danger? Many traditional remedies, especially from unregulated sources, contain hidden toxins like heavy metals or undisclosed chemicals that can worsen kidney damage. Even well-known herbs like aloe vera or turmeric, when taken in excess, may stress the kidneys. On top of that, some herbal supplements interfere with diabetes medications, increasing the risk of dangerously low blood sugar, hypoglycemia, or medication toxicity. If you're considering herbal treatments, always consult your doctor first. Opt for clinically tested, kidney-safe options like cinnamon for blood sugar control or ginger for inflammation. Remember, natural doesn't always mean harmless. Protecting your kidneys starts with informed choices. Number 8. Contrast dyes, the hidden risk in medical scans. If you have diabetes, chances are you'll need a CT scan, MRI, or angiogram at some point. These tests often require contrast dyes to improve imaging, but here's the catch. These dyes can sometimes lead to contrast-induced nephropathy, CIN. This condition occurs when the kidneys suddenly struggle to filter out the dye, leading to toxic buildup and, in severe cases, kidney failure. The risk is even higher for diabetics with pre-existing kidney disease, dehydration, or those taking NSAIDs and diuretics. Symptoms like reduced urine output, swelling, and confusion can appear within 48 hours of the scan. To safeguard your kidneys, drink plenty of water before and after the procedure. Avoid NSAIDs beforehand. and let your doctor know about any kidney concerns. In some cases, they may prescribe IV fluids and acetylcysteine to help flush out the dye safely. If contrast is unavoidable, ask about low-dose or kidney-friendly options. Being proactive about kidney health before scans can help prevent complications and support long-term wellness. Your kidneys deserve care and attention, and knowing which medications can harm them is the first step to prevention. Always consult your doctor, stay hydrated, and monitor kidney function regularly. A few smart choices today can prevent kidney disease tomorrow, because a healthy kidney means a stronger, healthier you. You might also want to watch this video for other dangerous meds for diabetics. And please subscribe to this channel if you found this video helpful. Thank you for watching.